And we're less than a minute out. I just want to give everyone a chance to get online since we said 6. I would ask all participants here tonight to go ahead and turn your cameras on. I kind of like seeing who I'm talking to as opposed to a bunch of little black squares. I think it makes it a little more personable when I can see who I'm talking with. I would appreciate it. If you're uncomfortable with it, so be it. Just a personal request of mine. No biggie. Let's go ahead and get started with this virtual town hall for the city of Walsenburg. My name is Brian Orr. I'm the co-publisher of the World Journal newspaper here for Werfenau County. And Mayor Lalander has asked me to do the moderating for tonight's meeting. So I'll kind of be playing roll call and asking people who would like to keep comments to a 3 to 5 minute window, unless you've got something that requires more than 3 to 5 minutes to get out. We'll have participants, we'll have people watching from the edges, and I also have the chat line open so that if people wish to ask specific questions, I would ask that you ask them in the chat line, and either I'll read them or the person you're asking to respond will get to them. I'm just gonna march my way down the line of who I've got here. Let's see, is there anything I'm missing? Okay, Karen, okay. Let us go ahead and start talking to people and asking questions. Kay, good evening, Kay. Again, lovely tree, thanks for doing that. Why don't you tell us what's going on these days out at the hospital and the Veterans Home, please?
Yes, I'd be happy to. As everyone's aware, and we did have an outbreak at our VA center, and we've also had an outbreak in the hospital. At the VA, we have now lost 7 of our residents to the COVID virus, and Dr. Mike can certainly talk a little bit more about that if needed. These folks do have other comorbidities, but still very susceptible. We've had several residents recover, which has been very exciting. And we also have some that were completely asymptomatic and never really got sick, although they did have a positive result. So but we're seeing more and more recover. And so that's been very exciting for all of us to be able to see some folks coming back and doing well. We've also had staff that have been positive. We're starting to see more of our staff come back to work. Fortunately, we have not lost any staff members to the virus. And again, I say fortunately, we're going to continue to watch this very cautiously. We do weekly testing. We actually do twice a week. And with our veterans, Mondays and Thursdays. And last Monday when we tested, we got all negative results for the residents. And that is awesome. That shows that, we're starting to contain the virus, and that's been our goal, is to contain it and try to stop the spread. We did test yesterday, or Thursday, excuse me, so we should start seeing test results tonight or tomorrow on those, and so I'll be able to report that. In the hospital, we do have a COVID unit as well. Right now we have 4 out of 6 beds full. We have lost 2 community members to the virus, and that was a week or 2 ago. We have positive employees that work in the hospital side as well. And so staffing has been a big challenge, and we're working to just try to cover it the best we can with, people working from the clinic who are coming over to help, people that are working in other departments are helping with trays and, dining and bathing and whatever we need help with. So everybody's really worked together. We've used some agency nursing, and at this point are still looking for additional help where we can find it.
Very good. You answered one of my questions about the how many beds are on your COVID unit. Another question that I have is, I'm hearing that we're going to be getting 100 shots of the vaccine here into Werfenau County, and 100 shots into Los Animas County. So I assume that's 50 people will get, the double dose of the vaccination. How soon will you get it, and who are going to be the first ones to receive it?
Well, and I can also let Dr. Mull jump in, but we have vaccines that will be coming for the veterans as well. So healthcare, frontline healthcare workers and the residents of the facility are in tier 1. And Dr. Mull, if you want to speak any more to that, but we will be getting a group of vaccinations from Omnicare CBS for the veteran side. And then I believe we are in tier 2 for the hospital. Kim may be able to comment on that. They're helping us a lot with the freezers and making sure that we're able to get the doses safely to our frontline workers. And those are in the tier 1. We have tier 1A, B, and C. And so it's just going to depend on when they first come in. The goal is to vaccinate all the residents that want to be vaccinated and all the frontline healthcare workers.
Outstanding. Cool. Mike, do you have anything to add in on that, sir?
Okay, it was pretty thorough. The only thing I have to add is that we're really excited about the vaccine coming out. I think that's going to be a game changer. I hope, I've looked at it quite a bit. I've talked to a local retired virologist who feels it's a very safe vaccine. He's excited about how it works. When you think about the flu vaccine is, I think, about 60 to 70% efficacious. This is 95. These vaccines, that's really incredible, and so we just want to get that out and start our residents, tier 1 first, and then down to our healthcare workers that are really exposed.
Excellent. Yeah, I'm just myself boggled that we're hearing 95% efficiency. I just didn't think that'd be possible. So that's thrilling. I'm looking forward to that. Getting obviously your residents, your professionals, and then over through the summer into the general population. It's the
Absolutely.
Hopefully, knock on wood, the silver bullet we're going to need to try and get things back. So good. Any other points to cover, Mike, while I got you?
Remembering with the vaccinations, because they're a 2-tier approach, and then it takes a little bit of time after you give the second dose. So we're expecting probably, and again, Kim can correct me if I'm wrong on this, but we're looking at about 6 weeks before we have the coverage that we're looking for the residents and the healthcare workers, and the community members, high-risk community, will be in that next group, that next tier. I also have Kenda Pritchard's our CNO, and she's on the line if you have any additional questions for her.
Excellent. Appreciate it. Excellent.
Thank you.
Mike, I want to bounce back to you. Was there any other points that you wanted to make while I've got you here?
A couple of points. We're really excited about our residents that have recovered, and the interesting finding of how it, even in residents that have a fair amount of medical problems, are similar in those ways. And you have one that is totally asymptomatic, and you have another one that gets very ill. It's just quite a fascinating thing to see from a biologic perspective. We have, having been in the COVID unit with our partner doctors, Dr. Dutton and Dr. Boynton, it is tough to see because, it's supportive care at this point. There are a few medications that can be used, but those are scarce and are usually the big hospitals have those. We try to get what we can, but it's very, very nasty disease in some people, and to sit and watch it and do our best and give our respiratory support, but to see people get that sick is sometimes pretty tough for our healthcare providers.
I'm certain. So the dosages are coming in, will they be in Monday, Wednesday, Friday? Can you give me more of a specific date that we would hopefully start vaccinating our high-risk citizens? Or high-risk citizens?
I do not have a date. What we were told from the state level when we spoke with the state is they were expecting these doses to start hitting the state next week.
Okay.
And at that point, I would say probably the 15th is when we have been given a date that we may be receiving some vaccine from the state, but Kim may be able to answer that question better than I can. That's what I've heard from the VA side.
Excellent, good.
I'll believe it when I have it. I want to see it. So,
Mike, I'm going to cut away from you, and we're going to go pick on Kim Gonzalez. Kim, I'm sure you've been listening. Please give us your update, your feedback, and answer any other questions, please.
Great. Thank you for having me. Kim Gonzalez with the Health Department, Public Health Director. I just want to touch, since we're on the topic of vaccine right now, the press release did come out this morning from CDPHE showing Los Animas, Huerfano County's District Health Department in 2 different areas. So Huerfano County through Public Health will be getting 100 doses specific to that county. And then Trinidad, Los Animas County will get 100 doses specific for that county through Public Health. As Kay alluded to, the nursing home as well as the hospital systems are not on our same vaccine order. We all had to actually put in for the vaccine provider allotment and approval through CDPHE and the FDA. So the nursing homes in both of our communities are through HHS and pharmacies, which are either CVS or Walgreens. Our vaccine will be distributed that way. The hospital systems will be getting their own allotments. In this press that came out this morning, Mount San Rafael Hospital is getting 300 of their doses in the first round. We did not get the first round of Pfizer between our 2 communities. That was very limited to Colorado in general. There was only 46,800 doses of Pfizer vaccine that even came into Colorado. So we will be getting the first shipment of Moderna because there is 95,600 doses that are coming for that. So Huerfano County will see 100 doses out of Moderna through the public health side, and we aim to target that 1A high-risk healthcare worker population and individuals, which does, these individuals and people must have direct contact with COVID-19 patients for longer periods, as defined as 15 minutes or over a 24-hour period. As part of their jobs, the phase also includes long-term care facility staff as well as residents. So I think between the 3 different establishments that have put in for vaccine certification, we will be able to get our communities vaccinated over the next course of the probably the next month, for 3 to 4 weeks. We are expecting Moderna to hit the week of the 21st. So the FDA will hopefully approve the EUA on Sunday, is what I heard today on the immunization call. And once that EUA is approved and voted on, at that point, then they start rolling out vaccine. Pfizer, of course, first, which is next week. We will not be getting that one. We're getting Moderna, which will be the week of Christmas. So it's almost like a Christmas miracle coming to our communities. We are excited to be able to be part of this. It's very stressful on all of us, and Kay and Kenda can allude to the amount of paperwork that goes along in getting vaccine prepared, getting your portal set up, getting these surveys, getting people lined out who are getting the vaccine, because there's such strict requirements once we get vaccine as to how it's even handled going forward. Any other questions on vaccine?
Yes, ma'am, I have a few. Are the only places in, I'm going to confine this just to Huerfano County as opposed to Los Animas County. In Huerfano County, or is the only place that a person can be vaccinated in December, January, February at the hospital? Can their primary care physicians vaccinate them? Will insurance cover it? What if they don't have insurance? Well, let's start off and where can they get the shots?
So once, so the hospitals will be vaccinating their own staff. The
Right.
nursing homes and hospitals will be vaccinating those establishments as well. Public health will be vaccinating the first responders within our communities. Those first responders do include EMS, law enforcement, anybody in first funeral services, anybody who falls into those tiers of meeting those requirements for vaccine. Those will fall under public health's responsibility for vaccination. There is no cost, it is free. Once we get to phase 2 or phase 3 of vaccine, we do not have what that's going to look like and who initially will be giving those vaccinations. We're certainly hoping that our providers within our communities will help us get those vaccinations out once it hits the laid community.
I know it's a very tricky beast to handle with such cold temperatures. I was just wondering what level of handling that would require. Okay. Thank you, Kim. I appreciate all that. And I'm looking through my lineup here. Are there any other health professionals here that I can talk to that want to chime in on this?
This is Kenda Pritchard. I'm the CNO at Spanish Peaks. And I can actually just expound on what we've kind of started planning for whenever we do have the vaccines for the public. We've practiced and done some drive-through clinics for flu shots. And so since the weather will likely be not very nice outside, we are prepared to do exactly what we did during our flu shot clinics, where community members can drive through. We will give them their flu shot or their COVID vaccine, and then we would repeat that and continue to follow them through the clinics with their primary care provider. So we have started some planning on that as well.
Excellent. Thank you, Ms. Pritchard.
Yes, you're welcome.
That brings me to a point. Mike Mall, I'm going to circle back to you real quick for a medical question. As someone who down the line in the phase 2 and phase 3, as they get a COVID vaccination, is it possible to get a flu shot at the same time? Or do you need to kind of stagger those?
I'm sorry, you went out for just a second. Is it possible to?
Get a COVID vaccine and a flu vaccine shot at the same time?
Yeah, that's a good question. Typically, you can do more than one vaccine at the same time. I probably would recommend against it because of how the Moderna and the Pfizer vaccine work. It's a mRNA technology, and it's a little bit different than your standard vaccine. So I would say, and since we don't, since it's new, we don't know a lot about it, I would say that probably would not want to do those vaccines at the same time. But, Kim may have more information on it, as may Kenda, but that is my inkling right now. I don't have, I haven't studied that, so I don't know for sure if it's, but from a scientific perspective, I would say, let's get the maximum bang for our buck with your immune system with something that's a pandemic right now.
Very good, sir. Good, thank you. Let us jump over to Brittany Carlo. Brittany, are you with us?
Yes, I'm here. Can you hear me?
Yes, ma'am, we can hear you.
Okay, so I'm Brittany Carlo. I'm the emergency manager for Huerfano County. At this time, we've been working closely with the health department to try to arrange consistent testing. We'll still be working on that. And for county office standpoint, we are open. We are encouraging as many employees to work from home, but we are open to the public. I know that has been a hot topic lately, but we are open. We do ask that appointments are made before entering the building. And I'm not sure if Carl has more. We have, we did receive CARES funding. We budgeted that and we're able to acquire PPE for several different agencies and as well as our staff. And we provided business grants, but Carl can provide more detail on that aspect. If there's direct questions for me, I am here.
Wonderful. Thank you, Brittany. Carl Young, good morning or good evening, Carl. You're in the hot seat. Come talk to us.
Well, good evening. Ruffino County, as Brittany said, is open for business. We do ask people to come in with an appointment only. For right now, the front door to the courthouse is locked. So we really want to encourage people to do your business either over the phone or with an appointment. And that also includes offices that are not in the courthouse, such as finance, public works, and the land use and building departments. We also want to let everyone know that service times might be a little slower because of COVID, but we will continue to work to get everyone's business transacted as fast as possible. The county has also purchased extra Zoom accounts and DocuSign accounts for our offices. So you have something to sign for the county. You might receive that via email through DocuSign. All this is an effort to slow the spread and to help keep county employees healthy and help make sure we keep the public healthy as well. As far as our CARES Act funding, the county has expended our CARES Act funds, and we are working for our last reimbursements.
Very good, sir. Appreciate it, Carl. Let's see. Veronica, I see you're lurking up there. Are you online? Can we talk to you, Veronica?
I'm here. Can you hear me?
Yes, ma'am. Please tell us what's up. What's new?
I'll even let you see me for a minute.
Woo!
So our primary, just like last time, my primary focus has been food and feeding people. And I can't say enough to Ruffino County and Road and Bridge and everything that those guys do month in and month out. We're seeing record numbers. We average in Walsenburg alone anywhere from 200 to 300 households that come and pick up boxes. I'm currently working on a report for the whole year of what amount of food has been sent in for both counties. So once I get that together, I do plan to present it to both counties, to their boards of commissioners, as well as sharing it with the newspaper so we can get that out. It is a lot of food, and Department of Human Services has been wonderful in Ruffino County delivering those boxes to people who can't get to it. So that's kind of what we've been doing. Our senior program, we continue to deliver meals out to people. We're doing about 40 in town. I'm surprised there's not more, but it's pretty consistent with those 40. And we do have a little bit of capacity to pick up some more if we need to. We do still have pickups available, so we have a good handful of people who come daily to pick up those meals down at the community center. And again, we thank the county for providing us that facility as we get our new facility going, which hopefully will be in the next year. We'll be breaking ground and getting a new one built up at our office at the Polk address. Lorraine was not able to get on, and she just wanted to reiterate that, you know, all of us, we are putting all of our precautionary measures in place because we do work with the public. We are in their homes. We're, you know, getting all of our PPE in place, sanitation procedures, temps. We do have temps and symptoms daily. She said they are limiting community interactions with their shopping and errands. So they're just trying to be more efficient when they do have to do that. They do still have several positions open for good caretakers. We're always in need of those. And she said that with the exception of Thanksgiving and Christmas, that they are open year round. Our senior program, we run Monday through Friday. We did go ahead and close for Thanksgiving the day after. We will close for Christmas Eve and the day after. But other than those major holidays, we are there. We are providing meals. My staff even stepped up and opened Columbus Day and Veterans Day because we know how important it is to get people food. So with that, we do blizzard boxes every year. We're required to do those for homebound. We extended those to anybody who picked up meals. So those are like a shelf stable, 6 meals in a box. We gave those out the week of Thanksgiving. I ordered double this year. We'll give another box out the week of Christmas. So we'll get those out. The State Unit on Aging was offered FEMA food boxes that were originally offered to emergency management, and they had a surplus of those because they weren't requested. So they offered those to the State Unit on Aging, who in turn reached out to AAA's. So I have a number of those coming for all the people we feed. I did order some extras, but it's a 30-day supply of groceries in a box is what they're calling it. So we should be getting those in within the next week. And like I said, I have enough for the people we serve already, and then I have some extras. So if you know of any seniors in need, please send them my way, and if we can accommodate them, we definitely will. But that's really kind of been our focus, is feeding people. And we've seen a big increase as things started opening for glasses, hearing aids, dental, those kind of things, and getting people out. So we still have those services available as providers can provide those services. So we still offer that to everybody 60 and over. And I think that's about it. Any questions?
If you have those extra boxes that are not being spoken for quickly, why don't you please send me a press release here at the paper, and I'll get it in the paper. Try and get you inundated or something like that. But
Okay.
I'd hate to see those not get used up. So
me either. And I'm going to also reach out to see if I can order more, because I think that, you know, when we were doing food distributions, you know, we did those solid every week for like 6 weeks, and then we went to twice a month from May till October. And then in November and December, because of the holidays, we've only been doing one, and we get a lot of calls. And, you know, so we're hoping in January we can go back to doing two, as long as the county affords us their road and bridge guys who rock that every month. But if I can secure some more of those FEMA boxes, I really want to do that. I am also working on some other programs with other funding that I oversee, to see if we can get some other kind of food stuff in place. So food's my focus.
that's brilliant. I'm really glad to hear that. Really glad.
Thank you.
Thank you for that. Let's see. Hugh, Mr. Keating, why don't you chime in, tell us what is going on in your world?
Thanks. I'm Hugh Keating, clinician for Health Solutions in Walsenburg. Teresa Keller's the supervisor for Los Animas and Huerfano counties. She's on also. So we're seeing a lot of pretty steady enrollments. People are accessing services. They seem to have sort of acclimated to doing, you know, relying more on the telephonic and the televideo. Either option is available to people. We still see people face to face when it's necessary. And yeah, if you know anyone that can use the services, the enrollment is just our main number, which is out of Pueblo, is 545-2746. I'll put that in the chat also. But okay. And also just let me know if anybody has any questions or concerns they want to follow up with me on. The local office is, well, actually my extension is 423-1403.
Okay, excellent.
Teresa, did you want to add anything?
I think you got it covered. I think the only thing to add would be the FEMA funding for the Spirit team has allocated a position for rural. So we do have someone dedicated to that position. And that person is not serving Health Solutions clients per se, but is available to the community. Her name is Pamela Solano. And she is a native to Los Animas County. She's been up in Denver for, I guess, a number of years. And she is available to help assist in connecting folks during this time who have been impacted by COVID. I'm not really sure who hasn't, but anyone who is needing to connect to basic services, applications for Medicaid, et cetera, that is available. Also, you can just go to that website and there's a connection there for that Spirit team, but I'll see if I can put it in the chat box as well.
Please, I appreciate you putting that information up on the chat line. Cool. Okay. Look this over. Mayor Lalander, you've been lurking there in the corner. Why don't you give us a brief summation, Brian, as to what's going on with the city?
Like the county, the city is open for business, but it's only by appointment only. We've been trying to beef up our internal protocols and get everybody separated better, because once you go into quarantine, that has a huge impact. The quarantines can have a huge impact. So we're going to try to not have that happen again, where we don't have any public works people on duty. And then we're trying to cooperate in any way we can. We'll continue to make the train depot available for any testing that Kim can get coordinated, and praying that everybody stays safe, wears their mask, and social distances.
Excellent, good. I'm looking over the roster here of the
Brian, if I could circle back, because you had brought up a good point with the combination vaccine, and I did a little research while we were talking, and there are organizations looking at the combination vaccine, but they don't want to, affect the efficacy of either one. So, that's going to take a while to figure out if you can do a flu and a COVID at the same time, but that's a great idea. But the point it brings up is that, get your flu shot now, because, you don't want to mix them until they do the studies that show that it's okay to do both. So if you haven't had your flu shot, get it now. And then when the COVID vaccine comes out, you'll have already had your flu shot. So
That's great advice.
Thanks for bringing that up. That was great.
That's great advice. Mike, I see a question in the chat line here. Someone has asked, what illnesses would you say are high risk for people who might get the shot?
I think it's been widely looked at in the news, and the concern is in people who have severe allergic reactions, anaphylactic reactions, and severe allergies, that they need to be careful. And I think what we're going to probably do is probably need to have some EpiPens available should we run into reactions like that. But other than that, it's a very, very safe so far, as with the number of studies out, it's a pretty safe vaccine. So
Excellent, good. Are there any other health professionals on this line that would like to have their say on this? I think we've gone through the list of who was expected to speak. I'm looking over the chat line. I see someone was asking about oxygen needed for seniors, and looks like some numbers have already come up to help with that, so that should be in the chat line. I'll throw this out to, again, kind of an open question to healthcare providers, Kim and company. Any suggestions to help reduce the mental health impacts exacerbated by COVID? Kim, you got anything for me?
Sorry, I had to find my way out of mute. I would say as we come into the holidays, even prior to COVID, it's always a time that we do see a lot of depression and a lot of substance use, a lot of other mental health disorders that come to fruition. And now in the time of COVID, it's even worse that we're going to see this going forward, especially through Christmas and the new year. I would just reach out to our healthcare providers. We have Health Solutions on. We also have behavioral health independent providers within the two communities. We have a public health behavioral health specialist now housed with public health, who's helping with the substance abuse component of it as well. If we can all, I know right now we're saying no intermixing of households, but there's a lot of other things that we can be doing to still keep our spirits up and looking at the holidays going forward. It's going to be tough the next couple weeks on until February. I can really see us rising in cases over the next few weeks, as well as even though we're getting vaccine out there. But if people can, video chat, still talking on the phone, I think that's a lost art, is actually just picking up the phone and talking to people versus just texting or chatting. And so I think, enjoying the outdoors still, if you're able to, with not today, but going outdoors, taking walks, being with pets. There's a lot of other things we can do with each other, and just, pick up a good book, reach out and call somebody you haven't talked to in years, spark up those old conversations again.
Excellent. Good. Thank you, Kim. Hugh, I'm going to ping the same question off to you. Any advice, sir?
Yeah, definitely. Anyone that's concerned, recommend you're concerned about a loved one struggling with a mental health issue, please give them our number. Also, I think the idea of sort of adjusting your expectations, whether it's with the children, with school, and no one wants to see, kids not learning, et cetera. But I think the multiple stressors that people are dealing with, loss of income, and just besides people being ill with this, the loved ones who have the illness, is kind of adjusting the expectations whenever you can, and keep it safe coping. So the idea that some people might tend to use substances more during this time with the pandemic. It can also be a great reason to reduce substance use, in terms of, going and finding the group to party with or whatever is going to increase your risk of getting the virus. And so it's a good time to, another sort of support or reason to stay home. And but yeah, definitely good comments from Kim, and stay close to your supports. Pick up the phone. That's a great, I want to echo that. So
cool. Good. Thank you. The last question I see on the chat line is, why are grocery stores not stopping people from coming in unmasked? I don't think there's anyone else here who can really answer that. They're private businesses. They should be enforcing it. I know that Family Dollar is really good about it. Other businesses, not so much. Obviously, they should be. But as private businesses in America right now, they are free to do or not do as they see fit going into their, we just wish they would, because obviously masking is going to be such a critical component in the next 1, 3, 6 months going forward. On that note, I think we have talked to the healthcare professionals and anyone else lined up that I had on my list. Any last second comments from anyone?
I want to thank everybody that's doing this. Thank you.
Absolutely. And there was someone else.
Yeah, I just wanted to reiterate what Hugh had said. There's a lot of public health measures out there that are important, but then there's the downside. And the downside is, isolation for some people. And I think what we're all saying, including Kim, is, keep your eyes open. It might not be somebody that you are visiting, but you're worried about. You might call them and then, let them know that there's resources available. Health Solutions, Hugh's organization, and other resources in our community that can help people. There's a lot of downsides and a lot of negatives, and certainly we need to do masking, we need to do our distancing, we need to do what we need to do to keep the virus from spreading. And basically why we're doing these things is not only keeping it from spreading, but keeping our hospitals from getting overcrowded. Southern Colorado is really in a crisis right now. And, Parkview has taken the brunt of things as far as ICU management in Southern Colorado. And so that's why we're doing this, is to try to keep the load off of our hospitals, and then trying to keep it from spreading, of course. But yes, there is that downside economically, increase in domestic violence, lots of downsides. It is a balance, and you know, I have a great deal of respect for Health Solutions and their organization, and often refer people.
Cool. Excellent.
This is Veronica. I just wanted to comment, when you were talking about the vaccines and the drive-throughs and things like that, is there some plan for people who don't have rides, don't have a way to get to those, to get the shots? I mean, is that something, I mean, I would be happy to be in on that conversation. I just worry about, you know, there's a lot of people that I know we serve, that they have no way of getting around. And if it's on a weekend, even more so. So please reach out to me if there's any way I can help when we get to that step. I would love to help come up with some kind of solution.
We really appreciate that, Veronica, and I'm sure we'll be working with our home health agencies as well, to where we can involve visiting nurses and make sure we can take care of our community.
And even if it's, you know, you need help with funding to get those resources in here, please reach out to me. I would love to be a part of helping that happen.
Outstanding. Very good.
And just to touch on that, this is Kim Gonzalez. Veronica, once we get to that next phase after we get out of 1A, we will look at doing a tabletop exercise with all of the key partners and stakeholders as to what it's going to look like to get the community vaccinated. So definitely include you in that conversation.
Thank you, Kim. And I would also, you know, like to, you know, whatever we can do to get our staff on that list too, as we are out there in the community trying to keep those people safe,
Absolutely.
getting them food, doing all that. So thank you.
Welcome.
Good, good, good. I would like to close by saying thank you all for attending. Here at the newspaper, if there is anything that you wish to get in front of your fellow citizens in Werfenow, Los Animas County, please send me press releases, updates, information, anything that you think readership needs to have. We can put it online. We go, you know, obviously there's the Dead Tree Edition. Please reach out to us as well so that we can help get information to the broadest possible market. Everyone have a great weekend. Yes, sir.
Just one quick thing I wanted to say. The city also is going to try to do a economic assistance to individuals. So look for that coming out probably on Wednesday. And we'll make this video available, and I'll share that with you, Brian, and it'll be available before the night's over.
Outstanding. Outstanding. Good. All righty, folks. Thank you for showing up. Have some happy holidays, and let's all look towards to a brighter tomorrow. Thank you, folks. Good night.
Thank you, Brian.